that are out there that are wanting their shots, but we're still some way stumbling. I'm going to talk about that in just one second. You know, our Saving Our Wisdom clinics and everything are open all, in all 55 counties. Weather, and stuff may cause us, to be able to delay. But now get this, we have, so far there have been 221,000 individuals in the 65 and older population in West Virginia who have chosen to get their vaccination. We only have about 350,000, but really and truly that's 64% of our 65 and older that have absolutely stepped up and gotten their shots. Now we want to exceed 75%, but I want to exceed 85 or 90%. And so in doing so, way back when, whether it was the unemployment checks or whatever it was, I said we got to triple what we're doing. And then we couldn't even get there with that. We had to triple the triple, did we not? Well, we're tripling the triple right now as far as Saving Our Wisdom. To make sure we are getting all West Virginians over 65, I've directed our joint interagency task force to set up 3 fixed location clinics across the state so that we can get anyone over the age of 65. Now what that basically means is just this. We're going to have 3 areas, and if you can get there, even if some way, somehow, you're on the wait list, we can't get you called or whatever like that, we want you to come. I've also directed them to make certain that we're clearing out our pre-registration list so we do not miss anyone. So basically what we're doing is we're going to go back through the list, and if we've got to put 100 people on the telephones calling everybody, now here's the problem. We call 1,000 people. We can only get through and get 30 people or 60 people or whatever of the 1,000 we call, and we clear the list. And then we got to go back through and clear the list. And so absolutely we're trying, we're going to have people on the phones. We're going to have 3 locations to where people 65 and older can come to. If that doesn't work, we're going to go up every holla, anywhere and everywhere we can, and we're going to get you. We're going to get this done, and if triple the triple doesn't work, we'll triple the triple. Now, we're also sending more people to our call center, just like I said, to assist in the calls. In some way, somehow, I just don't say it for the sake of saying it or giving me time to get my thoughts together and say it's a good question and everything. Really, at the end of the day, those questions made this happen. And really, all I needed to know was we have an issue here, and then I got moving, and all the great people that I have behind me and everything that have done all this great work, they jumped on it, and we're gonna make it happen. That's all there is to it. We're gonna get it done. We've got 64% of them right now. My goal is to get 85%. 75% is great and is acceptable, but my goal is 85%. If we get 85%, that means 15% basically have decided that they don't want to take the vaccine no matter what. I can't make them do that. But really and true, my goal is 85%. The COVID vaccine info line's up. The vaccine reminders, you've got to take your vaccine, people. As I say it over and over and over. There's no antlers involved in the vaccine. Absolutely, just think just this way. You may know somebody out there that got sick for 2 or 3 days. You may know somebody that felt really bad for a day or 2. You probably don't know people out there that dropped over dead or grew antlers or another arm or something like that when they took the vaccine. But you've got to know this. You've got to know that as I read this list, there is 2,600 West Virginians that have died a miserable death without their loved ones by their side. They have died. And with this, I don't know of anybody that really gets this vaccine and then gets COVID and gets sick enough to go into hospitals, and that may happen, but this vaccine, some way, at least on the very lowest side, ensures you of some level of safety. Now, there's no way any of us can promise everything, but the amount of people that get hospitalized with the vaccine are very low, and the amount of people that die with the vaccine are almost never. Absolutely, if you don't have this vaccine, just listen to me every day. I'm reading all your brothers and sisters of West Virginia all across the land almost every day. And in doing so, people are dying. If you're over 50 years of age, especially if you're over 65, you've got to take this vaccine. You have to. It is a mistake beyond belief not doing that. From a standpoint of unemployment income tax exemption, today I am announcing that I have submitted a bill to the legislature to exempt the first $10,200 of unemployment benefits received in 2020 from the state income tax for the 2020 tax filing year. Now, this is a huge tax break for thousands of West Virginians who had to endure some really tough going. Now, I know other states are saying, no, hold on, because we've gotten more significant benefits and extended more time for the unemployed coming from the federal government. And some states have said, no, wait a minute, we're good with all these extra dollars going to the unemployed, whether they be an additional $300 a week or an additional $400 a week, whatever it may be. We're good with that. And we're good with extending it, like the federal government's done, but sure to goodness they ought to pay taxes on this money that they're getting. Some of the states are requiring you to do that. I am sending up and saying, we are not going to require you to do that from the state, from the state taxes and everything, and it is a huge tax break for people that are really struggling. Should we not do that? We can do this. We can afford to do this. Those are the people that really and truly are really hurting, and for all practical purposes, by no real fault of their own. They lost their jobs. And that's all there is to it. There have been a total of 197,351 West Virginians that have received unemployment benefits in 2020. Now just think about it. I know just as well as I'm sitting here that some people are scamming the system. And I know just as well as I'm sitting here that some people ought to be working, and really and truly they're sitting at home scamming the system. I can't help that. There is a tremendous amount of people that are really hurting that are not scamming the system. Those are the people I'm trying to help. From a standpoint of this exemption applies to nearly $1,360,000,000 that have gone out in unemployment benefits to the people that I'm talking about. So the long and the short of it is, we're still standing rock solid trying to help all of our West Virginians, and we're trying to help us get through this whole pandemic, and it has been one tough going. As far as the tax filing deadline, there's an extension on that as well. Yesterday, I announced that I directed the West Virginia State Tax Department to extend the West Virginia income tax filing and payment deadline until Monday, May the 17th, to correspond directly to absolutely match right up to what our federal government recently announced as far as the tax filings on the federal basis. Individual taxpayers do not need to file any forms or call the West Virginia Tax Department to qualify for this extension. Individual taxpayers do not need to file any forms to call the West Virginia Tax Department to qualify for this extension. Now, I've read it twice. However, as far, well, let me finish here. This relief does not apply. Now, this is really important. This relief does not apply to estimated tax payments that are due on April the 15th. One more time. You do not, as far as the filing deadline, you've got till May 17th. As far as your estimated tax payments, you still have to make those on April the 15th. So that's the whole deal. As far as getting tested or free testing that's out there and everything, go do that. The free testing map's up there. We thank Frith, we thank Walgreens for all the good work they've done. We have one outbreak in our long-term care facilities. It's amazing. It's absolutely unbelievable. Our churches have bumped up a little bit. We have 7. I always read the counties. They're only in 5 counties. That's Fayette, Webster, Monongalia, Raleigh, and Nicholas counties. I tell the church community over and over, you've done phenomenal work. Keep at it, keep at it. But right now, we've bumped up a little bit. We got to be on our guard here, and we got to get that down. We only have 31 inmate cases in the state of West Virginia and 3 staff cases. 24 of them are at North Central, and 3 each are at Western and South Central, and 1 at Eastern. So many kudos to our corrections people and how they've run to the fire, and all those that are around them, from our health communities to the National Guard to the sanitizations that we've done. It's good work. It's really good work. All of our guidelines are up there and everything. I tell you over and over about wearing your face guard or whatever, and that covering is your really line of defense. And just watch our nation. If our nation starts to tick up, always you should remember one thing, and you should remember this loud and clear. West Virginia is an older state, the 3rd oldest state. West Virginia abounds in chronic illnesses. West Virginia is located without an ocean around it, within a rock's throw of population centers that are unbelievable, that are coming through our state nonstop. Please, please just wear this mask. Wear your mask just a little while longer. I don't like it. You don't like it. But if we don't watch out, this thing's going to backfire, and this thing's going to whiplash and really hurt us. I also ask you that if you have recovered from COVID especially, please go and give blood. If you can do it, I think that you owe the good Lord above the blessing that you were able to recover. If you are able, I underline able, if you are able to give blood, please consider it. We need you. We really need you. So that's all I got. Thank you all so much.
All right, thank you, Governor. Let's now go to West Virginia Superintendent of Schools, Clayton Birch.
Thank you, Jordan. Thank you, Governor Justice. I feel like some of the things might be repetitive, but they're worth repeating. A lot of the things that Governor Justice talked about this morning. First and foremost, today is March 19th. It was January 19th, just 2 months ago, that the governor put us back into the classrooms, opened up our schools, especially for our elementary and middle schools. And I will tell you, since that time, I cannot thank the counties out there enough. I was quickly trying to draw a little map here, thinking about where I've been in 2 months, everywhere from Wheeling to Parkersburg to Doddridge, Taylor County over in Grafton, Wyoming, and McDowell. And all of these places I've been, I saw a common theme. And the common theme was visiting places that are following the mitigation strategies. And each one of those places I went to, the students, the teachers, everybody understood wearing the mask made the biggest difference. And they were following the rules, following the mask. And I'll tell you that the governor probably understands this as well as I do, that not only in some of these visits has it been in the capacity of the state superintendent, many of these visits have been in the capacity as a high school wrestling coach. And when you go to these events, it's really, really important that these extracurricular activities follow the mitigation strategies as stringent, if not more stringent, than even in the schools. We want to make it safe, and we want to make it last as long as we can. And I'll tell you that, most recently, I was just at Parkersburg South High School, Wheeling Park High School. What they were doing there to keep the students and the athletes safe, I was so impressed. I just cannot thank them enough. Also, as I travel around the state, many folks don't realize I actually do ride a bus with the students, and I can't stress that enough. You've got to wear your mask on these buses. Just because we're on a trip coming in and out of school, to school, from school, we have got to be diligent with the mitigation strategies. The places we see where they're following them, we see a much lower case of outbreaks. I'm sure that Dr. Marsh and the folks here would agree with me that the mitigation strategies mean the world. So again, thanking our teachers, our staff that invited me out into the schools to see what's working. I just cannot thank them enough. And it's exactly as we heard from the beginning. It was safe to open schools if we follow the mitigation strategies. Now, to the vaccines and thinking about all of our folks that have been vaccinated, we know that the Governor Justice put a very, very aggressive timetable on prioritizing educators. And I don't know that everybody realizes just how aggressive that timetable was, except for maybe the folks on this call and the Joint Interagency Task Force. They clearly understood how aggressive the timetable was. The end of January, we were really impressed when we hit about 21,000 educators, service personnel, public, non-public. We were so excited to hit that number. Here recently, we just found that we're now up over 38,000 vaccines. And that means everybody who was asked, if you're a teacher, a service personnel, a substitute teacher, a coach in the public schools, in the private schools, if you asked and wanted a vaccine, we got it to you. And my hat's off to everybody on this call, the local health departments, the folks that held the clinics at the schools. It was just an amazing, amazing feat of how many vaccines we got out there so quickly. And we hear the governor call us a shining star, and he wants to continue being the shining star. Well, I think that what we've accomplished with each and every educator and anybody in the education field who wants a vaccine getting one, we absolutely, we need to acknowledge that. But unless we continue following the mitigation strategies, and we continue moving forward just for a period of time, as he said, longer, we've got to do that to ensure that we remain in school, we remain safe, we remain healthy. So Governor, on behalf of the West Virginia Board of Education, Department of Education, to everybody on this call, I think we absolutely are that shining star, especially for educators and those in the education field across this nation. Thank you.
All right, thank you, Superintendent. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good morning. It's great to be with everyone today. Reinforcing what the governor has said, we know that vaccines are really powerfully effective. We're watching very closely what's going on in Europe between Germany and Italy compared to Israel. Israel has been very, very aggressive at immunizing their most vulnerable part of their population, and they are not experiencing the third wave of the COVID infection transmission problem that Germany is and that Italy is. Italy has shut down their country again. And we know that from this data and so much more, that for us to continue to do well as a state, as Superintendent Birch said, and the governor has said many times and said today, that we not only hope that each West Virginian choose to be vaccinated when it's your time, but also until that time, and even after you've been vaccinated out in public, it's really important for us to really maintain very much discipline related to our mitigation measures, mask wearing, physical distancing, hand washing. There's a new bit of news out of Kentucky where a person came into a nursing home. It appears as a visitor, although it's not clear from reading what is available right now, who was infected with COVID-19 and ended up infecting 47 people. Most of the residents there have been vaccinated, which has protected them. Of the people who were not vaccinated, 83% of people developed symptoms. Of people who were vaccinated, 30% of people developed symptoms. This is both residents of the nursing home and staff. 5 people had to be taken to the hospital, 4 that didn't get vaccinated, 1 that did. Not clear whether those are residents or staff, and nobody has died. And so as we look at the situation we're in today, we have talked about the variants, we've talked about the fact that this pandemic has always surprised us. And although we, I think, are on a very good path, and with the governor's leadership and certainly the leadership of the JIADF and DHHR, National Guard, the whole team, we are in a very much better position than we could have been in. But we still have the most vulnerable state going into this pandemic. We still have a lot of people in West Virginia that aren't vaccinated, as the governor just said, including, 30% or so, 26 or 7% of people who are over 65. And again, we know that our over 70-year-old group accounts for 77.5% of our deaths, our over 60-year-old group, 92% of our deaths, and over 50-year-old group, 97% of our deaths. So it's really good news. Vaccines are coming in much greater supply. That's an absolute gift to all of us. People are getting vaccinated, which is great, but we're not done yet, West Virginia. And I think it really pays us to keep paying attention. And the other thing I'll just say, and I'll stop after this, is we've seen a real uptick in our younger part of our population over the last 7 days. The majority of cases are really happening in our young people. And it's really important also, we know that in this classroom with the appropriate mitigation measures, that's still very safe. We've seen no transmission between students and teachers in classrooms, but we also know that it's easy, particularly with, young people playing sports and being together and socializing, that we need to pay a lot of attention, because we also know that these variants that are coming to the United States have a higher tendency to be able to infect young people. We haven't really seen that variant, the United Kingdom variant, pick up so much in West Virginia, but it's just a matter of time, and it will, and it is here. So I think it really encourages us to maintain the highest levels of being careful, making sure we're caring for ourselves and each other, getting vaccinated when we can. And as we do this, we continue to lead the way, but importantly, we continue to save the lives of our fellow West Virginians and protect their health. Thank you.
All right, thank you, Dr. Marsh. The rest of our panel is available for questions. We'll now go to questions from members of the media. The first today from Kitty Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. First of all, thank you, Governor, for your action on getting older West Virginians vaccinated. That's incredible news, and good luck to those who are assigned to taking care of that task. Kentucky and Ohio have both opened vaccinations for their entire populations. Well, they've set dates for those for later this month and also for April. Do you see an opportunity for an announcement for when all West Virginians will be eligible? You may have already announced it and I missed it somehow, but where is that in the pipeline where you open up vaccinations for all West Virginians? Are we days away? Are we weeks away? Months away? Thank you very much.
I think I can answer this best and everything. Kenny, this is something that I'm really staying on top of with both feet. I'm going to constantly listen to the experts, and because I am not that, and especially from the medical field, and as well as our general and him telling us what we're capable of and everything. But Kenny, without any question, we're maybe not days away, we're days away from maybe an announcement of when we're going to be able to open up, but we're probably weeks and not months away from being able to open up to all of our population, because, Kenny, what's going to happen if we don't watch out is we're just going to have exactly this happen. We're going to have 100,000, vaccines come in, and we're going to dry up on the supply of arms to get in those vaccines. And if we don't watch out, we're going to end up with 40,000, and I'm exaggerating to make my point because there's no way that's going to happen, but we're going to end up with vaccines that are in the warehouse, and then another 100,000 comes in, and then then we'll knee jerk. We need to plan. Our people are on top of it. You're talking to a medical team that is unbelievable, in assistance with DHHR and in assistance with the National Guard and what General Hoyer's done, and our coronavirus czar, Dr. Marsh and Dr. Amjad and Secretary Crouch. I'm telling you, they're on top of it, because I hate to say this, and it's just the truth. They know that there's a big guy, a really, really big guy, that's not going to have it any other way. I mean, that's all there is to it. Every minute matters in trying to save a life. And when you do something with this, like you're doing it the way bureaucracies do it, really and truly, you're going to have people die on your watch that you could have helped. And we're not going to have that happen. And so from time to time, I've got to, I don't want to say sit on people, but I've got to really get after them and inspire them a little more. But boy, they're good. They are so good. We're on top of it, and we'll let you know as soon as we can.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and I'm only on these briefings on Fridays now because I'm covering the session. So if this was addressed last week, I greatly apologize for asking the question again. But in the case now that we have these additional 20 unreported deaths, which I'm sure were found, because I know you all announced last week about trying to increase how often you kind of check these lists. What are the penalties or repercussions? I mean, what is it that the state can do to these hospitals and long-term care facilities who aren't timely filing these these death reports? What exactly can the state do in these circumstances? Thank you.
Dr. Amjad and Secretary Crouch, you guys answer this. I know you can do it better than I can.
Yes, Governor. I'll start with that, Steve. As far as penalties go, we've talked with our Office of Inspector General, and I don't know if there's so much of a financial penalty or anything like that. It's more of a process where we want to have accurate reporting for data. So it's not so much of a penalty per se in that sense, because the data is important that we need to have for just our COVID-19 deaths. So data is important in order to give information, to make decisions. So there isn't so much of a penalty or anything like in that sense, but we're looking into that because accurate reporting is very important in decision making, as you can see, in giving information not only to our governor, but also to the state as far as information goes. But we have looked into that. All facilities want to report accurate information. We want to see what the systems are in place for them to give that information to us. But other than that, I'll see if Secretary Crouch has anything to add for that.
Yes, thank you for the question. One of the most important issues related to this problem is transparency. The governor has been absolutely adamant that we are transparent with everything that happens. So we're fixing this problem. We're moving forward in we will determine where every one of those deaths, where the problem was with every one of those deaths. And the issue is providers in some cases. In some cases, the information was transmitted to the local health departments where it's then transmitted to DHHR. We're going to fix that. We have too many pieces of this puzzle to try to fit in place. We're going to streamline this process somewhat. Ultimately, we're going to have an electronic reporting system that fixes this problem. But in the meantime, we're gonna change the process so that providers submit that information directly to us as soon as we finish the investigation. And we're going to make sure we get that information accurately, timely, and then it's posted and everyone is aware. As the governor said, we want to honor these individuals and to have those death certificates be the only source of information that's not working. That's a timely process. So thank you for the question. It's a good one. We will be transparent and we will fix the problem. Thank you.
All right, thank you, Stephen. Next to John Mark Shaver with WV News.
Hi, everybody. You spoke about this last week, but I'm hoping to get an updated number. How many people are left in the state registry who haven't started the vaccination process yet? Thanks.
Okay, Secretary Crouch, maybe you can answer that as well.
Yes, sir. If I understood the question properly, how many people have started the vaccination process? I'm sorry.
Oh, no. How many people are still left in the state registry who haven't started the process yet?
Oh, in the registry. Thank you. I have a good example for that. That's a great question. We started calling people. The governor directed us to call these individuals directly. And we have local health departments now, beginning yesterday. This was all coordinated through the Joint Task Force, the JIADF. We have directed local health departments to call individuals 80 and over first, 70 and over after that, who are on the registry. So we're going to reach out to those people in the next day or so. In fact, our folks at the call center yesterday contacted all of the African-American individuals aged 65 and over. So yesterday, beginning late yesterday afternoon, we contacted we attempted to contact a total of 1,225 individuals aged 65 and over on the registry. 482 of those folks, or about 40%, almost 40%, did not respond. We called 3 times during the course of the evening. Only 215 people out of the 743 individuals we reached still wanted a vaccination or had already gotten a vaccination. Others had already gotten the vaccination or did no longer want to be vaccinated. So we have 215 people out of 743. That's an indication of the individuals on the list who have already gone to pharmacies, FQHCs, clinics, et cetera, to get vaccinated. But we're clearing that list and we're going to improve that system so that it works much better. Good question. Thank you.
All right, thank you, John. Next to Ryan Quinn with the Charleston Gazette-Mail.
Hey, 2 questions. The first is for anyone. Are you seeing a trend of an increase in in-school spread in public schools recently? Do you know why? It seems schools are having more significant outbreaks in Boone, Fayette, Lincoln, and perhaps other places. And the second is for the governor specifically. Are you going to sign or allow to become law this education savings accounts, Hope Scholarships vouchers bill that the legislature has sent you? And if so, why? It's estimated to add about $100 million in new state spending annually. And you said in a previous session of ESAs, quote, why in the world would we need to go and sandpaper a lion's ass?
What was the very last thing Ryan said? The last sentence, why in the world?
I said, quote, you said of ESAs in a previous session, the education scholarship accounts or education savings accounts, but why in the world would we need to go sandpaper a lion's ass?
Okay, well, it's quite a saying, isn't it? But Ryan, I'll answer the tail end first and everything, and then I'll go back to the first end. But the tail is just this. I'm awaiting that, and I know that it is coming to me. And as soon as it comes to me, I'll look and I'll surely think really hard about exactly what I'm going to do. I'm leaning towards signing it, but at the same time, I will give it some really, really strong consideration. Both ways. That's what I always do. And the other thing, as far as the outbreaks in schools, you're exactly right. We are starting to see a trend to where we're getting a little uptick, from the standpoint of positive cases in our schools, and that is probably, to some degree at least, even expected. I mean, we're now playing ball games at our schools. we're now really opened up all across our state with the exception of one red county today. You know, from the standpoint when we had multiple red counties, whether it was 10 or 12 or whatever it was, those schools from the standpoint of our 9 through 12 grades and everything were not open. They are open now, you know, and only one county were shut down in, and I think that was Webster County today. I'm not exactly sure, but I could be wrong about that one county. But nevertheless, it is expected. We need to stay on top of it, and if we get any level that is alarming, I'm sure my medical team and everything will tell me so. But remember, Ryan, this thing is something we've got to live with. We have got to live with, and we've got to go on with life. And we've got to have our kids in school. You know, ball games are really important to a great many people. And from my standpoint, first and foremost, school should trump any kind of ball game. But at the same time, I'm sure a coach, and I surely understand the importance of sports to our communities and our kids and parents and on and on. So everybody is going to just have to stay on top of it and watch. We expect it a little bit. It's a little bit of an uptick. And as far as the back end of your question, I will do exactly what I always do, and that is I'll be fair-minded, and I will absolutely do the very best that I can possibly do for the people of West Virginia.
All right, thanks, Ryan. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Superintendent Birch, welcome back to the panel. A couple questions about education. Is there any plan to measure or do an ascertainment on where the students are with regard to their grade level learning? Will parents have the option of perhaps holding their kid back if they don't think that they've gotten enough out of this year so they don't wind up struggling next year? Questions along those ends, Superintendent. What can you tell me?
Superintendent Birch, this is you, sir.
Yes, sir. No, I appreciate the question. So kind of in two parts. One is, yes, we are actually continuing forward with this year's assessments. I know that many of the principals and teachers asked whether those assessments would be tied to accountability. They will not. But all teachers and the state board, myself, agree that we have got to continue moving forward to attain the information to really figure out what kind of learning loss we're really tackling. So we know where we're going with assessments. We're actually just invested, I believe it's $34 million into a summer learning program that all of the counties have applied for. Looking at some robust ways to really support our children throughout the summer and the whole child. And then we are working with each and every county as they move forward into the fall of 2021 of how do we prepare for the transition for the majority of our children back in person, and really for each one of our teachers to be prepared to assess where the child is, any potential learning loss, and to close that gap. So we will have a full task force that will be working with the superintendents and principals to really look at what the learning loss looks like and the best strategies to move forward to reduce that gap as quickly as possible.
All right, thank you. Paul, Governor, I'll turn it back to you to close out.
Well, I don't know that I've got a whole lot more other than I very proudly signed a bill today, you know, that was championed by Riley Moore, our treasurer, and I was joined by our majority leader, Amy Summers, and our speaker, Roger Hanshaw. It was a bill basically that does exactly this. It's called Jumpstart, and it gives us the opportunity to help those that have decided and decided in their life that they want to pursue the trades, whether they be a welder or they be an electrician or, you know, a plumber or, you know, mechanic, whatever it may be. And God knows we need those people, do we not? Really and truly. You know, not everyone's cut out for this traditional four-year degree, you know, and absolutely the backbone of this country are the people that go to work with their dinner buckets every day and perform incredible work with their hands. Now, so that bill will truly help, as has the free community college and a lot of the other things in technical college and everything that we have out there. A lot of those things have been really beneficial, but we just need to continue to do more and more and more to help, and that's what we do. That's what we do. So I congratulate our treasurer. It's good stuff. Our majority leader and our speaker, good stuff. And and I have been a proponent of that from day one. So it was an honor to be able to sign that bill today, right before our briefing. I would tell everyone, in regard to what is going on within our state, I am grossly disappointed with deaths not being reported timely. We'll get to the bottom of that. From the standpoint of 2,600 West Virginians that we've lost, please keep them in your thoughts and prayers. That's an incredible number, and a number beyond belief. It's so high. They need you. Their loved ones need you. I need you. Your prayers absolutely mean something. We're going to get through this. We're really close, West Virginia. Wear your mask. Put up with this thing just a little bit longer. Absolutely, we're close. We don't want to slip back. That's all I got. God bless all of you. Thank you.
Will now be in order. Those persons not having privilege of the floor will please vacate the chamber at this time. Members and guests in the galleries will please rise as we are led in prayer this morning by the gentleman from 26, Douglas Evans.
Father, I pray that you will surround our delegates and staff with grace to be men and women above reproach.